Two of COVID-19 vaccinations continue for the second day in Limpopo. It's aimed at vaccinating the elderly above 60 as they were identified as vulnerable to contracting the virus. Let's look at what's happening this morning. Senior reporter Aviwe Mtila is out and about for us. Aviwe, good morning to you once again. And how is it progressing there? I mean, are the elderly sitting and waiting very long? Is it a smooth process for them this morning?
Well, they've come out in numbers, Yuveka, at one of the areas where they're now just waiting for their jabs. They've done the registration earlier on. Now they've come to the side where the jab is actually done inside. We heard the targets there from the MEC of Health, pointing out that they want to at least get 1.6 million people around Limpopo vaccinated by the end of November when phase 2 comes to an end. But I see some prominent leaders of Limpopo here around. I want to touch with them first, starting with the chairperson of the South African Council of Churches in Limpopo. Thank you for joining us at eNCA, Mdomkulu. Just your thoughts as you're about to go inside to receive your jab.
Well, I've already received my jab, and we are excited with the organization that we see here, the way the departmental officials are helping the people who are queuing here, and the efficiency with which they have done this work. So we remain hopeful that many of those that we lead will take cue from what we have done ourselves and come and take the jab themselves. Yes.
I was about to touch on the congrats that go to your church. I want you to give them an indication of how you feel after getting your jab. How do you feel?
Well, so far so good. I think it's safe. I don't feel, any after effects since I took the jab. So, yeah, I'm okay, and I can encourage them to do what I have done. And many other leaders of the South African Council of Churches. The national leadership has given this indication, and we're actually following on their footsteps. And we hope the rest of the membership will do as we have done.
Okay, I want to come then to the Khosi in Limpopo, from the House of Traditional Leaders in Limpopo. Khosi, thank you for joining us at the eNCA. I know this is one of 6 hospitals around Limpopo that the vaccinations are being rolled out, but when you go to the deeper rural villages, what are the plans to get people vaccinated there? Are such vaccine sites available there?
Yeah, we have agreed with the MEC and the department that they should even use traditional council offices. That will be very good because they are just in the middle of the rural people and very easy to visit. For those people in the rural areas, it will be very easy for them to walk there, walk in and out.
Okay.
The proximity.
And then from your side, have you received your jab as well while you're waiting? And how are you feeling then after receiving that jab?
No, I thought I would be dizzy. By now they would be carrying me to a bed, but now I'm all right. It's now 20 minutes now. I feel strong.
Khosi, thank you very much there. Khosi feeling strong, the leader of the House of Traditional Leaders, feeling strong right after receiving that jab. No side effects. It is the Pfizer vaccine that's been rolled out here in Polokwane, Petersburg Hospital, where an influx of the elderly have come out in numbers. We hear that there's still communications between the House of Traditional Leaders and the MEC of Health in getting vaccinations going in the rural villages, but 1.6 million have been targeted to receive those vaccines by the end of November, Yuveka.
All right, well, I think we normally expect side effects a few days after, so it might be early days yet, but I think the dizziness he was expecting to feel was from actually seeing the size of that needle. Thanks very much, Aviwe Mtila. Yes, grown men, very afraid of needles, I know that. Well,